Oregon is looking for a game changer in the fentanyl crisis.
I think it'll implode. I think we're at a breaking point, absolutely.
Back in 2020, Oregon voters overwhelmingly approved Measure 110, decriminalizing hard drugs in the state. But after a shocking increase in overdose deaths in the state and open drug use on Portland streets, in 2024, Oregon is reversing course.
I think we voted the will of the people of Oregon who believe they were sold a bill of goods on Measure 110.
The legislature passed a bill to recriminalize hard drugs. The bill creates a new misdemeanor, and it allows each county to have their own standards regarding who gets treatment and who gets jail time.
I think we're going to see more and more counties want this because I think it's going to be much bigger than just the drug crisis.
While the Measure 110 changes won't take effect until September, we are now halfway through a 90-day emergency declaration in the fentanyl crisis. The city, county, and state's coordinated effort to make a dent in the crisis. Oregon State Police have been helping out downtown since October, and David Baer, a member of PPB's bike squad, has noticed a difference.
I like to say that I'm cautiously optimistic about the future of downtown. I would hope to say that rock bottom was, last year with the 4th and Washington building with the public drug use and basically the de facto open air drug market.
Will drug recriminalization be the game changer that Oregon needs? Are the city, county, and state acting with enough urgency to make a difference sooner rather than later? And what is happening to stop the illegal drug supply? We've gathered together addiction experts, local law enforcement, prosecutors, and regular Portlanders in our studio to talk about those questions and more. KATU's Recover Northwest Town Hall, the fentanyl emergency, starts right now.
And thank you for joining us for this special edition of KATU News, everybody. I'm Steve Dunn.
And I'm Deborah Knapp. Tonight, KATU is on your side, hosting an in-depth discussion on the fentanyl crisis in Oregon. Governor Tina Kotek plans to sign a bill recriminalizing drugs across the state. Looking at the most recent data from OHA, last year in just the first 8 months of the year, we had more deaths involving fentanyl than we saw total in both 2020 and 2022. From January to August of 23, there were 879 fentanyl deaths. That's compared to 839 in 22, 513 in 21, and 227 in all of 2020. And tonight we're talking with civil rights and community leaders, advocates, and law enforcement about the impact this latest legislation could have on the fight against fentanyl. We want to turn to Wright Gasway, who's at the live desk. And Wright, you're monitoring what our viewers have to say.
We are, Deb. All week we've been asking you at home for your thoughts on this recent legislation. If you'd like to weigh in at home, scan the QR code that's on your screen right now. The question is this: do you think the recriminalization of hard drugs is going to make a difference in the fentanyl crisis? Yes, no, or we'll see. You can see the results so far, about 58% saying yes, 21% saying no, and 23% saying to be determined. We'll keep checking back in throughout the show. We've also got this posted for you on KATU.com. If you or your loved ones are struggling, there is help available. We also have a list of resources on our website. Head to KATU.com, click the link for this town hall. You'll find numbers and information on where to find help. We're also keeping them at the bottom of the screen throughout the show. Steve and Deb, back to you.
And we'll be checking back with you very soon. Wright Gasaway, thank you for that. And for our in-studio guests, a slightly different question now. You can weigh in with a show of hands here when I read this. As you know, earlier this month, the Oregon legislature voted to recriminalize drugs like fentanyl, meth, and heroin. In January, state, city of Portland, and Multnomah County leaders called for a 90-day fentanyl state of emergency in Portland's central city. We're almost halfway through the 90 days right now. By a raise of hands here, who feels it's actually being treated like an emergency? Show of hands who feels like it is being treated like an emergency. Can we see that? Okay, let's have a show of hands who feels it's not being treated like an emergency. Okay, I want to move over now to our first guest I want to talk to. Sergeant Jerry Ciota, Portland Police Bureau. You've been with them for 27 years. You're the Central Precinct Bike Squad now. You see it all out there on a regular basis. Tell me about the fentanyl situation that you see on a regular basis on the streets of Portland.
I see lots of groups of people smoking fentanyl every day, groups of people congregating in front of businesses, in parks, making it difficult and challenging for people to use sidewalks and go into businesses. I see I see a lot of people who need help with their addiction.
You've had to bring some folks back to life a number of different times, particularly recently. Tell me about that.
Everybody on my squad, including myself, carry packs of Narcan with us, and we don't get called to people with overdose, but we ride bicycles, and when we come across a person who's overdosed, we distribute Narcan and do our best to bring them back to life.
Yep.
So I want to turn to Nicole Cristoforo, and you didn't raise your hand when we asked the question whether you felt like this was being treated as an emergency. You are property manager, 122nd and Gleason. Tell us why you don't feel like it's being treated as an emergency.
Mostly because when we are looking for a response, somebody has overdosed. We have so many issues with crime and graffiti and drug use, open drug use all over the property, what brings its share. We have multiple times reached out to agencies, to the police. I don't blame the police. I understand it's a bigger issue than that, but and nobody will get there when we can get there. That kind of thing.
So when you're a property manager of Menlo Park, what have you seen in the past couple of years as far as when you mentioned graffiti or vandalism there?
We've managed this property for a long time, and it was after 2020 when the Measure 110 went into effect. We started seeing, it took about 9 months, but we started seeing a huge increase in petty theft, and then it got more and more, breaking windows, stripping wires, graffiti, and then a lot of mental breaking and mental anguish of people just screaming and yelling, and it was just creating such a chaos for the tenants that are just trying to run a business out there.
All right, cool. Thank you.
Let's find out just how bad this fentanyl issue is right now. Dr. Richard Bruno, Multnomah County Health Officer, I want to talk to you about this because the folks at home, they hear a lot about fentanyl on the news and in other places, but they have no idea just how serious this issue is or how bad it's affecting our community. Sum that up for me if you can.
Yeah, thanks, Steve. Yeah, what we've seen with fentanyl, it's very cheap, it's very strong, and it's very smart. It really takes effect very quickly, and so people get overwhelmed very quickly with intoxication, and then after it wears off very quickly as well. So they're kind of going through withdrawal, and so it's really they're looking for the next hit to help get them out of that situation. So, at the health department, we take a very proactive work trying to make sure that we get access to treatment for people, so people can get access to drugs like medications for opioid use disorder like Suboxone or methadone, so people can reduce those cravings and be stabilized in the situation so that they're not looking for that next score of fentanyl.
And folks at home, some of them probably think it's the people who are on the streets that are affected only by fentanyl, but it's really not. I mean, you could be doing fentanyl and not have any idea you're doing it, right?
Yeah, it's a really unpredictable drug supply, as I'm sure that some of the folks here can tell you as well. What we're seeing mostly is these pressed fentanyl pills, which are little blue pills. We're also seeing fentanyl powder and other forms of fentanyl as well.
Yep.
Let's talk more about that supply. In fact, I want to talk to Chris Gibson. First of all, please explain to us what your job is. You can do it better than I can, and talk about where the fentanyl is coming in from.
Great. I'm the executive director of the Oregon-Idaho High Intensity Drug Trafficking Area Program, HIDA for short. There's 33 HIDAs throughout the country. It's a grant program that's funded and supported by the White House Office of National Drug Control Policy. It's a threat-based program, mostly pointed at reducing supply and addressing drug trafficking organizations and doing our best to put them out of business, or working with our law enforcement partners. The drug supply, as we assess it, I mentioned before, we're a threat-based program, and we take as much data as we can get, analyze it, and try and make sense of it as best we can. One of the primary things that we do is we look at drug supply and how it's getting here. And when we're looking at fentanyl, along with methamphetamine, heroin, and cocaine, it's coming from Mexico, being primarily controlled by two Mexican cartels. It's making its way across the southwest border to points in California, Arizona, Nevada, being broken down into smaller loads, making its way up into Oregon, primarily by passenger vehicle.
So is it an I-5 pipeline, basically?
An I-5 pipeline is definitely where our biggest threat comes from.
Okay. Thank you.
We can't talk about fentanyl without mentioning Measure 110, of course, which then became House Bill 4002, recriminalizing drug use, hard drug use of some particular drugs downtown. I want to talk to District Attorney from Multnomah County, Mike Schmidt. And Mike, we need to point out, of course, you're running for re-election. And originally you were all for Measure 110. You've switched in recent months. And of course, some folks on the sidelines said he's doing that because he's running for re-election. But tell me your thoughts on this and on why you think now this is the new measure, 4002, is going to be good for helping us on the streets.
Yeah, well, I think like a lot of people, I supported Measure 110 because we know that addiction is a health issue and that people desperately need treatment. And so the promise of getting all those treatment resources up in our community is, I think, what we all wanted to see. But, you know, we also saw a lot of other things happening. And I heard from a lot of people about the externalities of Measure 110 and seeing open drug use on our streets and not making our community be a safe and welcoming place for people to, you know, do business, walk around, do all the things that we enjoy doing in Portland. So that's why I like to partner with the legislature in getting House Bill 4002, because I do think it's going to put an end to open drug use, but it's also going to make a huge investment on a drop-off center. $25 million promised as a drop-off center here in Portland. And I think that can be a real game changer for how we actually hopefully get people connected to treatment when they need help.
Well, we know fentanyl is not just a Portland or Multnomah County problem. Washington County DA Kevin Barton joins us. Tell us what you're seeing in your county.
Well, we're seeing the same thing that people are seeing across Oregon. It's not a Portland problem. It's not a Hillsborough or a Beaverton problem. It's an Oregon problem. And we're seeing people are dying. Overdose deaths have dramatically increased. And communities are struggling. And that struggle that comes from the fallout, the collateral consequence of rampant drug use and drug addiction is impacting people every day. And it's impacting all walks of life, rich and poor, black and white, young and old. And so at the end of the day, the role of the DA is to make sure that people are safe and to promote safety in a community. That's why I'm so glad the legislature has passed this law to give DAs and law enforcement and communities more tools to help get people into treatment and keep people safe.
We're going to talk more about the new Measure 110. There's some folks who like it and others don't. We're going to hear from both sides. We continue our town hall after this.
Welcome back. Recently, the legislature made some amendments to Measure 110. I want to turn to Jennifer Parrish with the Urban League. Jennifer Parrish Taylor, thank you for joining us tonight. What are your thoughts on the recriminalization of drugs?
I mean, I think we have to be honest about how we got here in terms of, we now know that the state didn't fully implement Measure 110. And with House Bill 4002, what we're seeing is a very complicated proposal that, quite frankly, has been rooted and is disconnected from the realities of what's happening on the ground in terms of lack of resources for public defenders, in terms of lack of resources for treatments options, in terms of the lack of affordable housing. And so for Black communities, we're hit disproportionately. To be a Black Oregonian is to live with several comorbidities, such as unaffordable housing, such as dying at higher rates of fentanyl overdose, quite frankly, and a plethora of other issues that are only get exacerbated by House Bill 4002.
I want to talk more about the fact that this was a shortened session as well. What would you have liked to have seen?
Yeah, I mean, traditionally, as a lobbyist, we are always told that we don't do big policies in short session, that we spend the time and take the time to really have the debate over this policy in a longer session. And so quite frankly, I think the legislature was coerced into passing this piece of policy because of a ballot measure.
All right, Jennifer, thank you.
I want to bring in Sandy Chung now from the ACLU Executive Director. Thank you for being here as well. You say criminalization just does not work. Tell me why.
That's correct. Oregonians deserve real solutions to drug addiction and homelessness, which are crises in Oregon. But we know from 50 years of the war on drugs that criminalization does not work. And in fact, with fentanyl, I think what people forget is lawmakers actually passed a bill last session in 2023 criminalizing user-level possession of fentanyl. So when lawmakers again say this year, we're fixing this fentanyl crisis by criminalizing it, it's all political theater. It is not real solutions. And in fact, everyday Oregonians, as well as the experts, are agreed on what the real solutions are. We need more treatment. We need more housing. We need more prevention programs. We need more community revitalization efforts. And we need more non-police public safety teams like Portland Street Response.
You don't like what the lawmakers did, of course. You say there may be a basis for a lawsuit in there. Tell me about that.
Well, this is the thing. Our government services depend on limited tax dollars. And right now we know for treatment, right now 50% of the folks who voluntarily want treatment, only 50% can get into treatment. The Oregon Health Authority also stated earlier this year that we need more than 2,000 treatment beds at a cost of $500 million. What House Bill 4002 did was to take limited tax dollar monies and send it to law enforcement instead of putting it where we need it, which is more treatment.
Talking about treatment, let's go up to Tony Vesna up at the top. You've been on these town halls a number of times. Tony, give me your thoughts on what became 4002, which was Measure 110. Some of the folks here are saying, no, it's not the way to go to criminalize these folks. You've been there, right? You have been in there. You've been in that spot some of those folks are in now. What do you think about this?
No, I would agree that criminalization in and of itself is not a treatment to addiction. But I think what we have to look at is what are the levers we have to compel people to go to treatment? And all of the scholarly research shows that compelled treatment and voluntary treatment are essentially the same outcome. There's a short kind of deviation in it where compelled treatment's a little less successful, but I was, pushed to go to treatment through the criminal justice system, and a lot of people who get to treatment can change their lives, right? And so I actually think that this session is not a silver bullet. There's a lot of work to be done, but I feel like it's a step in the right direction. It's looking how do we minimally use the public safety services to push people towards treatment, right? And we kept all the money from 110, which I think was great, and then legislators did another down payment on a bunch of services. And so I think it's a step in the right direction. It's going to take time to fix. And what makes me most hopeful about the situation is that there's no longer a debate about do people who use drugs or people who are drug addicts, do they need treatment, right? It's uniformed across the board. And so we have to keep moving forward and working together and pushing our ideas against each other to create the best system possible.
Jared's right next to you. I want to bring him in on this because your recovery program is cultural specific, Native Americans, right? What do you think about this?
You know, I think, and I'm also the chief petitioner of one of the chief petitioners of Measure One of House Bill 4002. You know, I believe that we need as many interventions as possible. Jail saved my life. If I wouldn't be here today being able to help my community if I didn't have that break or that intervention to stop using. And I was able to stop using through that. You know, and the thing that really scares me is this harm reduction push and the decriminalization. In my community, they're causing more harm than reducing it. And what I mean by that is the overdose rates are higher, the suicide rates are higher, and we just need a change. We need a change, and that change is not happening. We at Painted Horse, we have an outreach team that goes into the streets. You know, I'm not saying that people sitting here in suits are not in the streets, but we see it firsthand in the streets, right? And when we're in the streets, if they have everything, the housing first model and all these things, they don't have no interruption in their use. So we made it a part of our program to go in and help intervene in that use and engage them and get them into peer services. I think having the law enforcement, is it the complete answer? No. But is it another intervention to maybe stop that use for them to get that moment to be like, hey, I don't want to do this. I want to do something different.
So recriminalization is the change you say your community needs.
I'm saying that, so you're a good politician.
No, I'm not. No. I'm just following up.
No, so what I'm saying is recriminalization is another intervention that can help get people off drugs and move them towards treatment with the stuff aligned in House Bill 4002.
Gotcha. Deb?
We heard that you said jail saved your life. We also need to talk about the public defender shortage that we have. So I want to turn to Grant Hartley, who's the public defender director for Multnomah County. How difficult is it to find a public defender?
I mean, if we're talking about for these types of low-level possessions, it is going to be incredibly difficult, if not impossible, to have an attorney on these cases for the foreseeable future. We currently have over 2,800 people in Oregon who are unrepresented, and this is not just an urban versus rural issue. This is throughout the state. In fact, Jackson County has the most unrepresented people. And, you know, there was an ABA report, American Bar Association report in 2021 that said that we have a third of the public defenders we need. We need 1,300 more. And since then, the state has made investments, but not enough to address this. And so most people will not have an attorney, and which means their case cannot move forward. And, you know, frankly, the public defense system has suffered from a similar issue as the treatment system, which is that it went through decades and decades of underfunding and being ignored by the system, and it had one, you know, substantial investment from the legislature, and people expected it to immediately be resolved. And that is not how our systems work. And so, you know, the treatment system that we have now is the same one that we had basically a year ago. And people need to recognize that people on the streets want treatment, but they cannot get it. And, you know, when folks spread false narratives about wanting to put people into treatment rather than jail and don't mention that treatment is not available, jail becomes the only option.
Coming up after the break, we'll have another look at the results of our poll and the impact this will all have on the fentanyl crisis coming up.
Welcome back. I'm Mike Gazaway. We'll get back to the town hall in just a moment. First, we want to check in with the results we've been seeing throughout the show. All week, we've been asking you at home for your thoughts on the recent legislation recriminalizing hard drugs. If you'd like to weigh in, pull out your phone, scan that QR code on the right side of your screen. The question is this: do you think the recriminalization of hard drugs is going to make a difference in the fentanyl crisis? Yes, no, or we'll see. Here are the results so far. About 200 people, just over 200 people have weighed in. That percentage for yes has ticked up just a little bit through the town hall. We'll keep checking back in throughout the show. If you or your loved one is struggling, there is help available. We have a list of resources on our website. Just head to KATU.com, click the link for this town hall. You'll find numbers and information on where to find help. We're also keeping them up at the bottom of the screen throughout the show. We're going back out to the studio after a short break. We'll discuss diversion programs and the 90-day fentanyl emergency. Stay with us.
Welcome back to our town hall. Of course, when we're talking about the fentanyl emergency, we have to talk about diversion programs. So I want to turn to Marion County Sheriff Nick Hunter. Marion County has had a program, the LEAD program, for 7 years about diversion program. Tell us how that's working and what else needs to be done.
Yeah, thank you, Deborah. So 7 years is where we started. It's grown and changed a lot in that 7 years. When we started out originally, it was just through the DA's office. It's now a program that's completely run underneath the sheriff's office. However, it is a wraparound service program. It involves the community. I've heard treatment. I've heard a lot of other things. One of those words that comes to my mind is accountability. We talk about arrest, but we get kind of confused on what arrest actually means. Whereas really what LEAD, law enforcement assisted diversion, what it's providing is accountability. And so what my lead navigators have the ability to do is we want them to have several entry points. So when anyone contacts them, because we do both social referrals, which is really diversion before we ever get to a criminal charge. But if there is a criminal charge, they have the ability to then engage that person in treatment. And when we look at, for us, when we're talking about possession equals treatment for us. Low-level crimes that are associated and have a drug nexus, that equals treatment for us. And when we're talking about theft or trespass, other things that are as a result of that addiction, we want a treatment-first approach. But that treatment-first approach is only going to work, and it's been said in this room tonight, if the treatment is available. And in Marion County, we do have those community resources that are available to not only focus on those folks that can come into the LEAD program, but we have some folks that wouldn't qualify. We still put them in touch with treatment resources and have a completely separate pathway for them. So I know I have a short talking point here, but it is very much a treatment-based program with accountability if folks are not able to follow through with what they want to do.
So House Bill 4002 really leads into that for you.
It very much does. So we, for the last couple years, have become very social referral only. It's not a bad thing. We built a robust social referral program through our hospitals, Santiam and Salem Hospital, through Marion County Fire, who we're currently training. We have the ability to, they can contact a navigator. It doesn't have to have a criminal nexus. But if they have somebody that comes in that has that piece where addiction has brought them to the hospital, or addiction has brought fire services or ambulance services to them, they can still 24 hours a day contact my navigators, and my navigators will come out and do an intake out in the field and figure out immediately, because we really have to talk about this as an acute problem. If somebody is ready for treatment, we have to address that now. It can't be tomorrow, and it can't be in 3 days. So what we have the ability to do is immediately stabilize that person, find them shelter, find them housing, and then immediately stay in touch with them as we're working to get them into a treatment program. That's where the success of LEAD really comes from.
Thank you.
This new recriminalization bill gives a lot of leeway to law enforcement and district attorneys, no question about it, when it comes to whether you want to send them to diversion or not. Is that a good idea or not, Mike, in your opinion?
I think it's a great idea. I mean, I really like what the legislature did here, crafting a approach that can be tailored locally, because different communities have different challenges. You know, the challenges in Portland are not going to be the same challenges in Gold Beach, not going to be in Marion County. So I think allowing for local folks to figure out what's going to work best for their community, I think is really a good thing to give that flexibility built into it.
How does this change your office overall, the new measure?
Well, you know, I think a lot of the work hopefully is going to be done in the deflection part of the way the bill operates. And so that's going to be really kind of what the sheriff's talking about with LEAD, police officers, other law enforcement engaging with people on the streets. If things go well and a person is deflected, then we may not see a case at all. Nothing will come to our office, no arrest, no prosecution, person gets services, and that can be the end of it. If that doesn't work, that's when you'll see things coming to our office. And then there's an operation in the law called conditional discharge, which again is another opportunity for somebody to get into treatment, do the work, and then the case can be dismissed without a person ever having to be convicted. And then even if that fails, then they would go on to a probation, have a formal probation officer. And in the worst case scenario, if they failed all of those different things, they might be sentenced to jail and a revocation, but can still be released to treatment from the jail on what the short-term trans leave part of the bill.
Tony Vesna's been shaking his head up and down. I want to get the microphone over there and ask Tony, when you hear about these diversion programs and these folks having leeway whether to send folks into them or not, give me your thoughts.
Yeah, like I said before, I think, you know, we're moving towards how do we use accountability and intervention when needed to push people towards treatment. You know, something that I've always talked about for a long time is that there's a lack of critical analysis of healthcare's role in this. So I see public safety, they're out there, they're asked to do this hard work to deal with us. When I was an addict, I was a problem, right? And they go to very great lengths to do it. And working with the criminal justice system, oftentimes they would have more of a basis understanding of addiction than doctors and nurses when I would go into hospitals. I would have a harder time partnering with emergency rooms, primary care physicians, and some other public health folks to help people get into treatment. But every time I went to the criminal justice system, they were ready to partner with us. So for us, like at 4D Recovery, we've begun to build relationships with public safety to say, hey, when you identify these people, call us and we will come and do our best to take the responsibility off of your hands, use our lived experience and our treatment services to get them the help they need. And so I just like want to applaud everybody here for fighting so hard to help people get into recovery. You know, it's something that changed my life. And one thing I don't see you guys doing in the media enough is when we have these shows, right, it kind of just shows the problem, right? And what we're missing from this conversation is all the money that Measure 110 put into the system, all the lives that were changed, all the people who got their kids back became good, upstanding citizens. So I would put a little bit of pressure on you guys to tell that opposite side of the story so that people get to see the investment of their vote. You know what I mean?
Tony's been in enough town halls.
Yes.
He's producing the show
He's practically a staff member here.
Yes.
We
Good thoughts, Tony.
We started the conversation of diversion with Sheriff Hunter, and you had some other input tonight.
Thank you, Deborah. I just want to add a couple things. One, what Tony is saying is really important. One thing that diversion has done for us is my navigators literally can do in 5 minutes like what we can't do in 5 years. But we have to understand that every individual that's experiencing addiction is not the same. And we have to be able to, and that's where my navigators and my program, with that accountability built in and used in the right way, as D.A. Schmidt was talking about, it gives them the ability to shape a program that works. And when we are not seeing necessarily the results that we want, and I want to say we want is not the right way to say it. Behavioral change occurs through the behavioral curve. Mm-hmm. So rapport is what navigators can use, and that's what Tony's talking about, that law enforcement can't necessarily build. But that rapport leads to influence and persuasion. I don't want to tell someone they have to change. We need people to want to change for themselves. And that may take 30 days, 60 days, 90 days. But what LEAD allows is once that navigator has contact with that person, that case management allows that to progress at the rate necessary to achieve that treatment. Understanding there are going to be ebbs and flows. There's going to be ups and downs. There's going to be relapses. But that navigator can stay with them the whole way, continuing to partner to work with our DA's offices and others to find the best route for treatment. And so we have to understand that individuality of each person. That's what we're trying to address.
Thank you.
We are in the middle of a 90-day fentanyl emergency. How's it working so far? We're going to ask these folks when we come back after the break. Welcome back to our town hall, the fentanyl emergency. We are right smack in the middle of a 90-day fentanyl emergency in the city of Portland, the central city. Is it working? We're going to talk to some of these folks about that. I want to bring in Stephanie Sullivan, Portland Fire Bureau, a deputy chief there. You oversee a Portland Street Response, also 3 different chat teams. That stands for Community Health, Assess, and Treat. So you're out there. You're out there with this guy on a regular basis, as a matter of fact. We're in the middle of this now, this emergency. Is it working?
Yes, it's working. As all these people here around me can tell you, this is not a new emergency. We've been doing this for years, decades. What it has done is brought us all together. So, for example, if you don't mind me telling you a quick story, we had an individual who overdosed. My overdose response team responded, gave him Narcan. My overdose support team came in later, connected him with services, medication for treatment for opioid use disorder, buprenorphine in the field. He wasn't transported to the hospital. We brought it to him. Then, with connections from this fentanyl emergency, someone from a TAS site, which is a temporary alternative shelter site, they got him right into housing, and we connected him with Recovery Works Northwest. None of that would have happened had we not had this fentanyl emergency declaration where we got all these people sitting at the same table in the mornings and talking about what kind of services they offer and connections.
You guys are communicating now.
We're communicating, yeah.
And that's happening for the first time. On my notes, I've got in February, 42 people who were ODing were saved by the chat team in February alone.
Yeah.
I mean, that's incredible. That's big time work going on out there. So thank you for that. Appreciate that.
I want to turn to Mary Rain O'Mara from Central City Concern, and you want to talk about what has worked under Measure 110.
Yeah, absolutely. So at Central City Concern, we've recognized for decades, right, that what is needed to address addiction is affordable housing, is recovery and treatment services. So we've been adding to that continuum over recent years. So I wanted to follow up on the good work of Measure 110. In 2021, we acquired a hotel with state funds, and in 3 months, we took that hotel to be early recovery housing. The first year of operations was funded by Measure 110. So that hotel now is providing 65 rooms of early recovery housing for people in our community. What we see is that we have folks that are accessing detox at our Hooper Detox Center. Half of those people we have to send back out into the community because we don't have enough of those step-down services. So this is an example of where we've innovated, and we did utilize Measure 110 to launch this incredible program.
And you've just acquired another building.
Correct, and I think this one really ties to, while we've had this emergency in our community for years, the 90-day emphasis, we were able to acquire another hotel on 16th and Burnside just last month, and that will be providing 60 beds of residential treatment by 2025. It was the quickest funding exercise I've ever seen. State, county, and city funds came together to help us purchase this hotel.
What's still needed, though?
Well, as we've heard, we still have a shortage of 2,000 beds throughout the state. So we need more of these programs, and there are organizations like Central City Concern that are working tirelessly to bring services online. And I think what is needed is consistent funding, right? We were able to utilize Measure 110. We're hopeful that we will continue to have consistent funding to really bring these services online, because that's what's needed to get at the root of addiction.
We'd like to hear from the folks who are right out on the street in the middle of this fentanyl emergency. This is one of Nate Nakasone. You run a security service for Old Town and also the Pearl District. Tell the folks at home what you see on a regular basis.
Well, I think the prevailing theme that our folks see in the field is drug dealing that's not being addressed. I think there's a lot of talk about the issue of usage and the usage side of it, and our folks have helped users connect to services without having to get the police involved. Sometimes we do have to get the police involved, but the theme that we see that's really not going addressed is the dealing side of it. Until we cut off the source, of folks injecting these substances into our communities. We're just addressing symptoms at that point. When a dealer is allowed to spread out baggies and a scale and a ledger on the front steps of a business or a school, and have absolutely no fear of any consequences in the middle of the day, that's a problem. I think until we take a firm stance on that, again, we're just addressing symptoms.
I want to jump over here to Sergeant Ciota if we can real quick. Nate, bring that microphone over. You heard what he said. I mean, these dealers are moving around on a regular basis. You see that as well out when you're out on the street?
Yeah, the Bike Squad neighborhood response team, we've been addressing the dealers as well. It's super challenging with a team as small as we are to address both the addiction side, the public health side, and the dealing side. We've arrested over 70 drug dealers in downtown Portland over the last 12 months. It's significant. But at the same time, we're also piloting projects to do outreach. It's challenging to do both.
And they're being held accountable in the prosecutor's office, are they? Mike Schmidt? You want to talk about that real quick?
Yeah. So we're prosecuting those cases when we get them, and that's another thing about House Bill 4002 that gets in there is there's a fix in the law that will allow us to charge people with dealing drugs when we know that that's what's going on because they have a big supply, and so we show that they have intent to deal. That's something that I think this legislation is going to help us hold more people accountable for drug dealing.
Great. Yep.
Washington County DA Kevin Burton's eager to weigh in on this as well.
Thank you. Well, I want to start by saying House Bill 4002 is not perfect. I think we can all acknowledge that we have a lot of challenges here in Oregon. It doesn't solve all of our problems, but I believe it makes many of our problems more solvable. So yes, there's a crisis when it comes to the management of the public defense services in Oregon. That's a crisis. There's a mental health crisis happening in Oregon for sure. There's a lack of treatment opportunities available in Oregon for sure. But what we know this will do, this new law is not experimental. Measure 110 was experimental, and it was an experiment that in many ways failed. There were some successes, getting more treatment beds, more money available for treatment, that's a good thing. The decriminalization was a bad thing. And so now what Oregon has done, and a lot of credit to our legislature, who came together in a short session in a bipartisan way. When's the last time we can say that happened? And they did something that will actually make a difference, boots on the ground for real Oregonians. So that's an incredible thing, but it's going to take work. We've got to tackle these other challenges and move forward. And the beauty of this law is it builds on proven examples. Law enforcement assisted diversion is proven to work. Drug courts and treatment courts are proven to work. So 110 was an experiment. This new law, it builds on proven examples that I believe will work.
Jennifer, I know that you're eager to also weigh in from the Urban League as well. You kind of looked back with a response there.
Yeah, I mean, I guess the question I would ask, at the expense of whom? This bill was passed knowing that there would be a racial impact to communities of color. We had legislators on the floor saying that I'm voting for this bill with blood on my hands. So I guess I would ask, if we know that there are going to be racial impacts to communities of color, knowing that there are, higher rates of criminalization of Black folks in the states, what are we doing to mitigate that? What specifics are we doing to mitigate that? And I would ask that of the legislature, I would ask that of the DA's office, and I would ask that of police, because we know it's going to hit Black and brown communities the hardest. And quite frankly, they passed this policy on data that did not include data from COVID, and it didn't include fentanyl numbers. So we're looking at post-COVID numbers, which don't tell the full picture of the impact of fentanyl on Black and brown communities. And quite frankly, we probably will see higher numbers of disproportionate impact to Black and brown communities.
Thank you, Jennifer.
Take a final look at our poll results from folks at home who've been weighing in when we come back after this.
Welcome back. Let's take one last look at the results of our poll. If you'd like to weigh in at home, scan the QR code that's about to be on your screen right there, the right side of your screen. So far, about 260 people have responded. Here's the question. Do you think the recriminalization of hard drugs is going to make a difference in the fentanyl crisis? Yes, no, or we'll see. So far, about 63% of people are saying yes, 20% saying no, and the rest saying to be determined. Again, if you or your loved ones are struggling, there is help available. We have a list of resources on our website right now.
As we're wrapping up the final couple minutes, I want to turn to Grant Hartley, Public Defender Director for Multnomah County, with some final thoughts.
Yeah, I just wanted to respond to really what the district attorneys were saying about, Measure 110 being experimental and returning to a system that has been proven. We have decades and decades to show that the prosecution of low-level drug possession does not result in people getting into treatment. It often exacerbates addiction issues. And so what 110 was not an experiment. It was a recognition by the public that this is a public health issue and that the criminal legal system is ineffective at addressing it. And, we are going back to that war on drugs with 4002.
Dr. Richard Bruno, Multnomah County Health, you guys held a summit. Tell me about that in about 20 seconds.
Yes, sir. The 90-Day Fentanyl Emergency Unified Command asked the Multnomah County Health Department to put together a summit, a fentanyl summit, where we could bring community leaders, we could bring together government officials, payers, and healthcare systems to talk about solutions for this crisis. And we're really excited that we got a lot of ideas on paper, and we're going to put those to the Unified Command so they can make policy recommendations for the future.
20 seconds on the dot. That was fantastic. Good job. Thank you all for being here. We really appreciate it. Thank you all for watching. Such an important topic. I promise you we'll stay on top of it here on KATU, and all these folks are doing all great work to make this a safer city for all of us. So thank you for watching, everybody, and good night.